This conference will now be recorded.
Good morning, students. I'm audible to you. Students, any one of you answer me?
Yes, sir.
Thank you. We are discussing about the food poisoning in the toxicology topics. Okay. Already we given an introduction of the food poisoning. See, not only in the hostels and restaurants and in our homes also, we are not maintaining the hygienic or proper handling of the food and proper cooking. It may lead to the food poisoning in the at homes also and house also, not only. And come to the point of view, so not only food and water, whenever you take the more than its dose or more than its limits also, it causes the food poisoning, isn't it? Now come to the food poisoning. Already we discussed about the introduction, the about World Health Organization. The definition of these foodborne diseases is: this is usually either infectious or toxic in nature, caused by the agents that enter into the body through the ingestion of the body. Okay, common in the warm temperature because of the multiplication of the organism. It favors the temperature, right? We discussed about the pathogenesis and food poisoning transmission and foodborne infections and intoxications, and depending upon the mechanism and incubation periods, we are discussing about this. And one of the most important pathogens for the foodborne or food intoxications are bacteria, protozoas, and nematodes, cestodes, and trematodes, and animals like catfish and dragon fish, plants and mushrooms, and chemicals inside. So only the food contaminated with the organism or toxins from the organisms, bacterial organisms, and not only that, the chemicals or insecticide may be accidentally or incidentally mixed with the food, may cause the food poisonings, isn't it? Right? And at the same time, food poisoning, most probably the bacterial causes are Salmonella, Staphylococcus, Clostridium, Bacillus cereus. And depends the types of bacterial food poisoning already discussed in the material information penetrating. And come to the depends upon the incubation period. Here can they differentiate the causative organism of this food causing food poisoning is 1 to 6 hours staphylococcus, like that, 8 to 16 hours, and more than 16 hours the causative organism Vibrio cholera and ETCC, like that. You have to go through the charts. You have to remember. And for the food poisoning, first of all, you have to take remove the person from the source of intoxication, and hydration by the ORS and IV fluids. Antibiotics you can go for the prospective antibiotics, ciprofloxacin and ofloxacin. Now come to the poisoning is over, and what is the medical significance? You have to remember this. According to section IPC 272 and 273, we are dealing with the food poisons and its punishments, especially imprisonment for the 6 months or fine after who are involved in this. And prevention is a very important of food poisoning is maintaining hygienic and personal hygiene and a separate relation of raw to food, and proper and thorough cooking and proper storage, and use of safe water. Already discussed. Come to the most important infection or the causative food poisoning is botulism. The Clostridium botulism is the toxin which is the one of the most powerful toxin, that is the neurotoxin. Neurotoxin, that is exotoxin in the world, but potentially fatal disease. It is intoxication, not an infection. Normally they present in the soil, dust, and intestine tract of the animals. Toxins used for the treatment of this botulinum toxin. It also have the medical value. So it's used in blepharospasm and strabismus and rhesus articulitis and Botox surgeries. So is the not only the toxin, it may be useful in the surgical surgeries and also and other medical conditions. Now come to the food botulism and wound botulism infantile. A food contaminated with the toxin, that means exotoxin from the botulism, that is the botulin, and wound botulism among the IV drug users may be transmitted. And at the same time, the open wound will be infected whenever there is an accidents in the open areas. The also organism of botulinum toxin present in the dust and it areas and will lead to the wound botulism. And infant botulism is possibly less than 6 months of the age. The bacteria grows and produce the toxins. Especially the SIDS, sudden infant death syndromes may be possible to may be caused due to infant botulism. Sudden infant death syndrome, not only staphylococcus, and this botulism may be lead to the infant botulism and cause the death of the individual in case of sudden infant death syndrome. So come to the food botulism. The organism can multiply in the foods but not in the humans. Why? Because it is a anaerobic conditions to grow. So it needs the anaerobic conditions to grow in the growth of the botulinum toxins. A toxin can be destroyed at the heating 80 degrees centigrade for the 30 minutes or 100 degrees centigrade to 10 minutes. So that way is a proper cooking may lead to the botulism. You can prevent the botulism. For example, they may grow in the tinned meat and sausages, fish and fruits. So you can avoid prevent by the washing it or and at the same time they may be heat proper cooking at the level of the 80 degrees centigrade maybe prevent the food botulism. And come to the what is the mechanism of the action, that is botulinum toxin or exotoxin or neurotoxin. What is the mechanism of action? Toxin is a powerful neurotoxin and it acts by blocking the action of the acetylcholine on the nerve endings and leads to paralysis. So it may be the general mechanism acetylcholine release and it is received by the receptors at the site of the muscles. So it may be blocks the acetylcholine releasing, right? And it blocks it. So that's why it leads to paralysis to all the muscles, not only the every body muscles, and it may lead to the paralysis of the respiratory muscles and fail, and may lead to the respiratory and death of the individual. So come to this is the normal mechanism that at the level of the myoneural junctions. See, this is the normal transmitter of the release. See, again the synaptic vesicle which release the acetylcholine has this snare proteins. So this is the normal mechanism. By that it will be released and transmitted to the acetylcholine released, and it will be received by the acetylcholine receptors present at the muscle cells. So this is the main normal mechanism. By this, what happens is whenever the toxin enters into the body, they may be blocks the and break these snare proteins. By cutting the snare proteins, it will be inhibit the release of the acetylcholines. So by that, it may be stop the myoneural junction transmission of the impulses. At the level of the myoneural junction, it may be stop the transmission of the impulses and lead to the acid paralysis. So this is the basic mechanism of the botulinum toxin, isn't it? See, what are the signs and symptoms at the first period after the food poisoning by the botulism? So the fatal dose is 0.001 mg. The paralysis in the muscles supplied by the cranial nerve starts with the face and proceed to the periphery first. So it is a neurotoxic, may lead to the paralysis, placid paralysis. Symmetric descendant placid paralysis is observed in this botulism. So symptoms are mainly in relation to the eye movements first and facial muscles, chewing and swallowing, isn't it? So first you can observe ptosis and double vision and diplopia, dysarthria and dysphonia, difficulty in swallowing and dysphagia, and difficulty in talking also. So the symptoms due to the action of the autonomic nervous system, the dryness of the mouth, constipation, dysphagia, and urinary retention and respiratory insufficiency. Also, these are the order of the signs and symptoms appeared in case of the botulism. So GI symptoms common are nausea, vomiting, and abdominal pains. Death due to the respiratory failure because of the respiratory muscles also be that means palsy will be occurred and lead to the respiratory failure, and consciousness is not affected till the end of the death of the individual. So CNS is not affected, that means isn't it? So paralysis of muscles supplied by the cranial artery starts with the face and proceed to the periphery by the botulism, and come to the see this type of the flaccid paralysis or paralysis of this affected in some other diseases You have to remember and you have to differentiate this from the botulism. The differential diagnosis from the encephalitis and Guillain-Barré syndrome. Also here also there is a muscle palsy, Guillain-Barré syndrome also, and ascending into the actual candula, ascending passive paralysis go to the testicles, and Guillain-Barré syndrome is a pediatrics are very important. Guillain-Barré syndrome and the tetanus and diphtheria and organophosphorus poisoning. Here also organophosphorus poisoning, acetylcholine is accumulated because of the blockage of the cholesterol. So like that, same symptoms will be appear, and you have to differentiate it depending upon the clinical history also and symptoms and for the diagnostic test. And cobra and crate bite also have to shows this palsy like this. So you have to differentiate encephalitis, Guillain-Barré syndrome, tetanus, and diphtheria and organophosphorus poisoning and cobra and crate bite. So here come to the what is the treatment for this botulism poisoning. See, first of all, you have to remember the gastric lavaging and add the activated jar. So remove the person from the source of poisoning and clean the body, and you have to go for the gastric lavage and activated jar. You have to do. The botulinum antitoxin can give a slow IV in normal saline and repeated after 2 to 4 hours. Unveil intramuscular you can give this botulinum antitoxins. And another one, botulinum immunoglobulins also you can give emergency department, and guanidine and alcohol in small doses you can give this. So this is the treatment aspect of the botulinum toxin and food poisoning. Okay. Now come to our aspect. What is the autopsy in this findings in this case of the botulism? So nothing specific and specific symptoms, but kidney, liver, and meninges shows the congestion. The medical legal significance most of the time, sometimes is a homicide. Most of the time is the accident. Then it is used in the chemical warfare. Chemical warfare and the warfare sometimes. This is the autopsy findings and medical legal significance of this botulism poisoning. And already I discussed, that means I mentioned in this particular food poisonings in general, and prevention and the treatment of the food poisoning is over. In the botulism and laterism and the epidemic dropsy. These are the 3-4 marks questions that a number of times they are given, very important in the entrance questions also. So finish the botulism. Now come to the laterism. It is a stable pulse. The type of the pulse flows under the drought condition. The people there will take the as a food, staple food in the central India among the food papers. Is otherwise real case with all under laterism. The active principle in this laterism pulse is BOA, beta oxalyl aminoalanine. So it produces a neurolaterism, a type of palsy, and the steeping of the pulse and the parboiling removes the 90% of the toxins from this. These are the laterism, the pulses. So remember, this is the toxin produced by that is toxin present, the active principle present in the laterism. So the people taking as the staple food. So whenever they are continuously taking as a food, so it may lead to the some signs and symptoms. It may be cause some palsies in the body, and they may be finally they lose their walking or and they may be dying because of this pulse. Is it? To produce the neurology, a type of palsy, no doubt. Steeping of the pulse and parboiling removes 90% of the toxins from this laterism. But they don't doing that. That's why they are suffering because of the laterism. Now comes these are the laterism seeds, which are pulses and they are taking as a staple food. And now what are the characteristic features of the laterism? So whenever they are continuously taking the food, progressive spastic paralysis, paraplegia with no effect on the sphincters and mental activity sensations. So in the earlier difficulty in sitting and getting up. So what happened? The paralysis of the calf muscles and gluteal muscles will be occurring there. palsy. Or first of all, the first symptom, there will be a spastic pain of the calf muscles. The toxin levels increases, it will reach the first spastic paralysis of the calf muscles. So it is difficult to walk. Here there is a 3 stages. There is no stick stage, 1 stick stage, and 2 stick stage. Remember, no stick stage and 1 stick stage and 2 stick stage. It depends upon the person. The palsy will be occur in the bones. Okay. First of all, earlier stage is difficult in sitting and getting up. This is the person, and later that it will be difficult to getting up from the squatting position, and like that it will be grows on. So the walks with the help of the stick with the legs and dragging on the grounds. So 1 stick stage and 2 stick stage. No atrophy, no loss of the muscles will be occur. Knee jerks are increased. That is the earlier stage step. That means spastic palsy and spastic spasm of the calf muscle. Then it will be appear to the overall the body. That means especially the gluteal muscles also occur in the palsy and may lead to the laterism. This is the, you can observe this, the laterism. That is, the person will be walking with the help of the stick. Isn't it? So neurolaterism and laterism characteristically spastic paraplegia with no effect on the sphincters, mental activity, and sensation. So remember, no stick stage and 1 stick stage and 2 stick stage at the last one also, isn't it? That is the laterism. Now come to the epidemic cross. Another one, that is the Arjumon mexica, the plant. All the parts of the plant are poisonous in, especially the seeds. So from the seeds, the oil will be extract the oil and mixed with the mustard oil as an adulterant. And people, they will be illegally, they will mix it with the this Arjumon Mexican oil, mix it with the mustard oil, and may lead to the this Arjumon epidemic crops. The oil contains 2 toxic alkaloids, that is sanguinarine and dihydrosanguinarine. This is the entrance process. Remember, epidemic dropsy. See, it grows widely all over the India. Oil from the seeds are sometimes used to adulterate the mustard oil. The oil contains 2 toxic alkaloids, sanguinarine and dihydrosanguinarine, which cause epidemic dropsy. What are the signs and symptoms of the epidemic dropsy? See, this is the plant, that is the Arjumon mexicana, and all the total parts of the plant are toxic in nature, and but especially the oil will be extracted from the seeds of the Arjumon mexicana. So now come to the what are the signs and symptoms which are adulterated. That means oil of the Arjumon is adulterated with the mustard oil. What are the signs and symptoms? First of all, loss of appetite and edema of the legs, and these are very 2 important points. That is edema of the legs and absorption. Loss of the appetite, tingling and hyperesthesia of the skin, and tenderness of the calf muscles will be occurred. Myocardial damage and dilatation of the heart may be occurred. Low blood pressure and rapid feeble pulse, and bluish mottling of the skin due to the dilated peripheral vessels may be occurred. Death due to the damage of the heart. So cardiotoxic, one of the cardiotoxic, and the oil may be sanguinarine or dihydrosanguinarine toxin is there, which may lead to the loss of appetite, edema of legs and anasarca, tingling and hyperesthesia of the skin. So it may lead to the death due to the damage of the heart. So epidemic dropsy, what are the signs and symptoms of the epidemic dropsy, and what is the toxic principle in this? Come to the mushrooms. So mushrooms, generally where edible mushrooms are there. Whenever they are mistaken, the edible mistake instead of the edible, we will mistakenly take in the poisonous mushrooms, may lead to the that is some poisoning of the food. So there are known poisonous varieties of mushrooms are there. Generally, agaricus is the edible one. We are taking as a food. But there are 2 poisonous varieties are the Amanita muscaria and Amanita phylloides. So Amanita muscaria contain toxic alkaloid muscarine, which stimulate the postganglionic cholinergic fibers. And Amanita phylloide is the second one, that is a powerful poison, and otherwise it is called death agaric and death capon. So it contains a toxin like phthalon, phalloidin, the amanitin, and they inhibit the cellular protein synthesis. So Amanita muscaria and Amanita phylloides, and you can remember. See, this is the Amanita muscaria. It is looking like a edible, but it is a typical colors, orange or red in color. The cap will be orange or red in color. It will attract the flies. This color will be attract the flies, and it will be kill the flies also. This is the Amanita muscaria, isn't it? Next, this is the Amanita phylloides. It will be almost looking like a edible agaricus, but there is a difference. Is the base consists of the cup-like base is ఉంటుంది, and it has a furrow string slab. This is the Amanita phylloides, which almost resembles the edible one, isn't it? So now consume the whenever you consumed or mistakenly taken these poisonous mushrooms, what are the signs and symptoms? So fatal dose 2 to 3 mushrooms will be cause the death of the individual. And what are the signs and symptoms appeared after taking these poisonous mushrooms? So the irritant symptoms are first, the constriction of the throat and burning pain in the stomach, nausea, vomiting, diarrhea, and cyanosis, slow pulse and sweating, and convulsions and collapse of the circulatory collapse of this person. And the neurotic symptoms are giddiness, headache, delirium, diplopia, constriction of the pupils, and twitching of the limbs, and bradycardia and cough. So these are the symptoms, that is the irritant symptoms and the neurotic symptoms divided by the mushroom poisonings. And come to the what is the treatment for this mushroom? So gastric lavage with the potassium permanganate and activated charcoal you can give, and forced diuresis and benzyl penicillin as an antibiotic you can give when further infections are there. Atropine sulfate to control this. And now come to the what is the autopsy findings in this? See, the information of the mucous membrane of the stomach and fatty degeneration of the liver and kidney particularly. And in case of the neurotic symptom, brain is congested and petechial hemorrhages in a serious manner. So come to this. Also, the mushrooms are Amanita phylloides and the muscarias. These two are the poisonous mushrooms which are mistakenly taken as a food, and it may lead to the death by the damage to the heart. So treatment with the gastric lavage, activated charcoal, forced diuresis, medicine and atropine, and these are the autopsy findings. So come to the mycotoxins, that is present in the meat and milk, and toxins are heat stable. The Aspergillus flaps can causes the mycotoxins can grow in any food and produce. So the aflatoxins which cause the carcinoma of the liver and so. So mycotoxins maybe really the toxin heat stable. And next come to the fish and marine animals also cause the whenever taking generally seafoods and we are taking as a food, but mistakenly if you take this some type of the fish may lead to the fish poison. That is known as the ichthyotoxicosis, fish poison, otherwise called ichthyotoxicosis. The two types of the poisoning are due to the bacterial growth, especially puffer fish. And fish contains poisons and ichthyosarcotoxins, toxins from the muscles, viscera, and skin gonads of that fish, particularly toadfish, catfish, and lionfish. So this is the toxins released by this fish and directly due to the growth of the bacteria in the puffer fish. So these are the fish poisoning, fish and marine animals poisonings. So this is the puffer fish and the bacteria, and this is the catfish. So remaining, I go through the textbooks and the food poisoning. I go through the textbooks and read thoroughly a number of times. And most probably in our food poisoning, they are given in the botulism and the lathyrism, neurolathyrism especially. They will ask in the as usually in Viva questions also they will ask, and epidemic cross due to the Arjumon Mexica. So these three are the questions very important from the And apart from this mushroom poisoning and fish poisoning also you can go through the textbook. Up to now they are not important, and they are PG levels. Fish poisoning ani this mushrooms also mushroom, okay, they can be in the UG also, but now up to now they are given in the UG levels botulism, neurolatherism and epidermic. So we have to remember and go through the test. With this we finish the food poisoning, and we will meet in the next class with another topics. Okay, thank you. You can, all of you can leave this.